started here. Welcome everyone. I'm Elise Washington. I'm a project manager supporting Missouri Healthy Schools. Missouri Healthy Schools provides students with lifelong advantages built on positive early health behaviors to improve conditions for academic achievement. You can check out more at mohealthyschools.com, and I'll be sure to drop that link in the chat as well. Today, we're super excited to have Dr. Lauren Schwarz back with us as part of a series she's doing on topics related to health and well-being. Dr. Schwarz is a clinical neuropsychologist who provides neuropsychological assessment with a special interest in patients who develop abnormal cognitive conditions from neurologic disease, neurodegenerative disorders, and psychiatric disorders. She also provides group psychotherapy. Dr. Schwarz is an assistant professor in the Department of Psychiatry, Division of Geriatric Psychiatry at SLU, and she's the director of neuropsychology. Today, we're talking about sleep, or lack thereof, I think for many of us, including reasons why you might not be getting enough sleep, types of insomnia, some facts and tips about improving your sleep. At Dr. Schwarz's request, I will actually turn each of you into a Zoom panelist, meaning that you have the option to turn on your microphone to ask questions, but you can also continue to drop things in the chat or the Q&A boxes, and I'll be sure to be monitoring those. Thank you.
All right, well, welcome everyone. And as always, thank you so much for your kind introduction. So so we're gonna talk about sleep today and my goals for our time together. So we're gonna talk about how sleep works. So we're gonna sort of do a crash course in Sleep 101, because I think it's important for us all to review what is the healthy architecture of sleep look like, so that we know sort of what's normal and what might be out of the normal box for us. Then we're going to talk about different causes for insomnia, and then some tips and tricks for trying to improve our sleep. So, okay, I love to always start off with a few facts about sleep that I think are rather eye-opening. And sleepadvisor.org is one of the resources I'm going to show you at the end of the talk. But they have it's sort of like advertising. Why is sleep important? Why do we need to take this topic seriously? So these are some fun facts. And I say I didn't totally fact check them because I didn't they do have citations on their website that are scientific, but I didn't look at the actual, scientific resource that they came from. So these are really amazing things that I was unaware of some of myself. That lack of sleep costs in the United States annually $41 billion. And so I'm assuming we can think about things like lost revenue. You could probably think about healthcare costs, but that's like a ton of money. 35% of us in the United States are not getting enough sleep. I thought that number would be a little higher, but that's a lot. Important for our students, 20% of teens are getting less than 5 hours of sleep a night. When we think about healthcare systems, 100,000 deaths a year in medical errors can be attributed to sleep deprivation. So that's why in recent years, for our medical residents, they've instituted duty hours. So they're only allowed to work a certain amount of hours a week. But prior to that, it was sort of no holds barred in terms of work hours. So, at least we're moving in the right direction there. 20% of car accidents are associated with sleeplessness, and about 38% of us will fall asleep at work unintentionally. And truth be told, I think that probably happens to a lot of us in boring Zoom meetings. Hopefully I won't put you to sleep today. But certainly you're in a meeting, you didn't sleep the night before, you get those little micro sleeps, and it's not uncommon. So let's talk about, now that we've kind of started with our pop media, some stats to get you interested in the talk. Let's talk about the science of sleep and how sleep works. So we know that, be in a cycle of sleep for 8 hours and wake for 16. And we have neurochemistry, neurotransmitters that are involved in helping us to go to bed, stay asleep, and wake up. So, our neurotransmitters are responsible for helping with this circadian rhythm. And then there are two main states of sleep, which are non-REM, rapid eye movement, and rapid eye movement sleep. So when we look at this of sleep, So the first stage of sleep is non-REM sleep, and this is when we're really transitioning from wakefulness to sort of feeling sleepy. And this is only about 5 to 10% of that part of the cycle. And then we get into stage 2 of non-REM sleep. And this is when the system really starts to cool down. So the temperature drops, the blood pressure goes down, the heart rate goes down, and then, the brain really begins to produce these chemicals that are important for sleep. And this is about 20 minutes of the cycle. And then really when we're thinking about deep sleep, that restorative part of sleep, that's stage 3 non-REM sleep. And that's when kind of our muscles are going flaccid, the breathing rate is dropping, and this is that really important part of the sleep cycle. And then we get into the rapid eye movement sleep. And this is when the brain is active. This is when, our body is immobilized, but our brain is awake essentially. And we're dreaming, our eyes are moving. And so that's kind of the active phase of sleep. So each one of our cycles of sleep lasts 90 minutes. And, in the first few hours of sleep, we're spending less time in REM and more in deep sleep. Uh-oh. Something in the chat. I want to make sure that there's not. Oh, okay. Perfect.
Oh, that's just me.
I know. I was scared. Like I said earlier, my internet is kind of funky. And so I'll get in my flow of speaking and somebody might be saying, Lauren, we can't hear you. When you look at the total percentage of sleep for each of these stages, I have it broken up for you there. But so I think it's important for us to just sort of understand, the architecture of sleep when we're going into thinking about sleep issues. This is really important for all of us to be aware of, that it should take us 15 to 20 minutes, more or less, to fall asleep. So if it's taking a lot less than that, that's a problem, and we'll talk a little bit about that. And if it's taking that, that's also an issue. So that sweet spot for when your head hits the pillow and when you're getting actually to sleep, this is the magic number for all of us in terms of healthy sleep cycle. And I'm not sure if that's surprising to anyone. And I'm wondering when we can certainly have a free discussion at the end, and that's what I plan for. But a lot of us are falling outside that window, I would suspect. I think in our culture, maybe I'm wrong, we have, it's a merit badge. I only sleep 4 hours a night and I'm just fine. So when people are saying that to themselves or to others, it's simply not true from a biologic standpoint. So here's a graph to give you guys an idea of how much sleep we really do require based on our ages. So, and there's a wiggle room of an hour, more or less on either one of this, but, really adults need 7 to 9 hours of sleep to function. It's so funny. So I do a lot of work with medical students. I'm the assistant dean of the School of Medicine at St. Lucie, and the students will come in and they'll say to me, Lauren, I do wellness planning for them. And they'll say, Lauren, I really think I'm spending too much time sleeping. And this is where I say to them, okay, well, wait a minute. How much are you sleeping? Well, I'm sleeping, 7.5 hours a night, and that's just too much. And we have to do some re-education there. So, I think there's also this sort of myth that once we get over the age of 65, we need less sleep. That's simply not true. I mean, the sleep requirement really is roughly the same in our adult years, even into our older adult years. And our teens and our school-aged kiddos really are ranging anywhere from needing 9 to 11 hours of sleep a night. So that statistic, about 20% of our teens sleeping 5 hours or less, that really has implication for the folks I suspect on the call, our educators, that chronic sleep deprivation has a whole host of implications for our learners because it has cognitive implications, certainly, and mood, and we're going to talk all about that. So why do we sleep? Why is it important? So sleep really helps us to maintain our focus. And memory it's very important for memory. It also helps to lower our blood pressure. It helps with mood. Certainly it's restorative for our energy levels. And also during sleep, our body is producing hormones that help the body. So it helps with tissue repair, fighting off infection, and even has some appetite implications, which are very interesting. So sleep certainly has a crucial role to our wellness and our overall health. So when we're not getting that sleep that we need, we're really at risk for complications. So health complications. Sleep deprivation is associated with things such as being overweight, high blood pressure, heart disease, even having a stroke. So really very concerning. Lots of our mental health conditions are also linked with sleep issues, such as anxiety and depression and substance use. And as I had mentioned earlier, sleep is super important for helping us with our immunity. So we do get impaired ability to fight off infection when we're chronically sleep deprived. And when we don't get enough sleep, we're accident prone. So when we're driving, I've read statistics and research studies that basically cite sleep deprivation is almost like driving intoxicated. And I think that we don't really talk about it in that way, but it is very dangerous. And certainly cognitive impairment comes with sleeplessness. So when we're talking about, so that's kind of the architecture of sleep, why we need to do it, and the implications of not doing it. So I want to kind of transition and spend some time talking about what does it look like when we're not getting good sleep. So insomnia. So there are two forms of insomnia. One is called acute insomnia, and this is the short-term insomnia, meaning it's occurring for less than a month. And this form of insomnia is really linked to things occurring usually in our life. So, things like loss of a loved one, stressors at work, divorce. Oftentimes when we are trying to figure out why we're not sleeping with this form of insomnia, we can really link it to an event typically. When we're thinking about chronic insomnia, this is when it gets beyond that month and it's long-term. And this is when the sleeplessness or difficulties with sleep are happening 3 or more times per week, and it's happening for an extended period of time. So what are the symptoms of insomnia? So, I think that, when we're talking about our sleep problems, it's not just, I think we get stuck, insomnia means we can't fall asleep, and that's certainly a huge part of it, but it's also that we can't stay asleep. So maybe you fall asleep, but then you're starting to get up a lot. So that's related to sleep maintenance. And then we unfortunately have the form of insomnia when we're getting up entirely too early and not able to go back to sleep. So this is when folks are like 2 or 3 in the morning and are unable to fall asleep. And certainly those are all very challenging to cope with. Also, you might be having trouble with insomnia. Another sign of it is that attention is poor. Waking up in the morning and not feeling like you had restorative sleep, daytime sleepiness, and being kind of grouchy. So irritability, changes in mood. These are all the signs and symptoms of possible insomnia. So what are the causes of this? So unfortunately, there are a couple of risk factors just in general that we can't avoid because they're who we are. So with age, we do know that we're at an increased risk of insomnia. So being over the age of 60. And then unfortunately, ladies have a higher risk of insomnia. And there's a link between our hormonal changes and this. So there are changes during menstruation, pregnancy, and menopause with the hormone system that are linked to insomnia. Certainly, we can pinpoint stress as a cause of insomnia, certain medical conditions, which makes sense when people are not feeling well. Zoom, and I read the chat while I was talking. That's so funny.
Yeah, Zoom is the Missouri Healthy Schools. We share an account for the events and started a call not realizing the conflict. So we're in contact with them, so they hopefully will not boot us out again.
Well, it's all good. You know what? We just laugh about these things because it's the COVID universe.
Yeah. So you should be able. We have people rejoining, so I'm so glad. Looks like people Hop
Yeah,
right back
thank
in
you
for us.
all.
That's great. Thanks, everyone.
Okay, all right. Oh, cool, here they come. Hello, hello. Okay, I'm gonna screen
Okay,
share
I
again.
will turn my video off and let you continue on.
Okay, hold on. All right, I don't know. Let's see, we were talking about insomnia, symptoms, causes. Yeah, here we go. Okay, cool. All righty. Okay. I think the last thing I was saying was medical. I don't know how much you heard, but I think I was saying that one of the causes of insomnia are different medical conditions, which makes sense. I don't know if my computer was still active on Zoom when I said that obviously when we're physically not feeling well, it makes sense that we're not sleeping well. Certain medications are absolutely associated with insomnia and sleeplessness. So any medication that sort of revs up the system can be associated with it. So, you know, when we're taking medications for attentional disorders like ADHD, medications certainly can cause insomnia in ourselves and, you know, students. Chronic pain makes sense for causing insomnia. We're going to talk about sleep disorders a little bit as well, but sleep disorders can cause this, and then mental health issues. All right. We also can look to things in our lifestyles, which this is the good news here. I mean, it's modifiable to a large degree. So things like smoking, alcohol use, caffeine. Now, I'm not saying don't use caffeine. Don't worry, we're going to talk about our relationship with caffeine in a little bit. And physical activity. So these things in our lives, which are modifiable in terms of our relationship with these things, also can be linked with insomnia. And then unhealthy sleep habits. So about those in a little bit too when we're talking about tips for improving our sleep. And then unfortunately going against our sleep schedule, and I'll tell you what I mean by that in a moment, is also a cause of insomnia. So what I mean by that is, and this is one of those factors in our life that's likely not modifiable. And so these are when we have situations where primarily we are thinking about shift workers. So folks that are doing overnights. In terms of their employment, we do see that when they are attempting to get back onto a normal circadian rhythm, that it's very challenging and can be associated with insomnia. So what are the different treatments for insomnia? So one area is what's called cognitive behavioral therapy I for insomnia. So CBT is a form of psychotherapy that is very much rooted in changing our thinking, and we'll talk about some of those things, but restructuring our cognition and trying to help our mood. And so one of the interesting techniques is called sleep restriction. And that may sound, you're probably all like, what is she talking about? That's counterintuitive. So sleep restriction means that we spend less time in bed so that when we ultimately get in bed to go to sleep, we're more tired. And so let me explain a little bit about this. So when we're talking with folks that have significant insomnia, we often, when we talk with them, find that they'll say to you, oh, I'm just laying in bed for hours and hours and hours on end. But that's really not good for helping with the sleep. So really trying to get yourself out of bed when it's not working so that you get more tired. This one is interesting. It's called paradoxical intention. And these are all empirically supported treatments. So you can still laugh at me and you're muted and that's good, but they do work. So this is getting in bed and trying to stay awake, which is interesting. So both of these techniques are part of cognitive for insomnia. And another one is relaxation training. So that was kind of the topic of my last webinar. But before we end today, we're going to do a meditative practice for sleep. And so we'll do that together. And then, of course, there are also pharmacological interventions for insomnia. And so I'm not an MD, so I'm not going to give a big talk on sleep medications. But suffice to say, prescription medications that are used specifically for sleep, and they do have their place. So when someone is suffering from insomnia and it really begins to result in functional impairment, either at work or in their, their home life, really there is a time to consider these things as an option, and they don't have to be long-term. So oftentimes when you'll see folks going to a sleep disorder clinic for insomnia, the best treatment is the CBTI, the cognitive behavioral therapy, in conjunction with medication therapy, at least in the short term. And then, if folks can identify with their providers what the cause of the insomnia is, let's say it's major depression or anxiety, oftentimes treating those situations and disorders helps with the insomnia as well. So it might be that someone needs to be on an antidepressant or an anti-anxiety medication, and that improves the insomnia. And then there are certainly non-prescription medications. So when you look on some of these sleep disorder websites, they talk about the use of melatonin and CBD as well for insomnia. Another one is something called valerian root as well. So all of these are non-habit forming, over-the-counter medications. I will say one thing that folks are not necessarily always aware about, that those over-the-counter like Tylenol PM or taking Benadryl certainly can have you fall asleep, and folks use those for sleepiness, but they do have a long-term negative outcome with respect to memory. So my clinical practice in neuropsychology is with primarily a focus on older adult memory disorders. And when sleep is an issue, I find that a lot of folks are taking these Tylenol PMs, and unfortunately they work on the neurotransmitters that support optimal memory performance. And so these can be exacerbating memory problems. So just kind of buyer beware. I'm not saying that they don't have their place, but just make sure you know the possible side effects. See a sleep specialist. I think that's sort of important for us to know. So when there's extremely loud, if we have a bed partner that reports to us, man, you are snoring extremely loudly, that's a sign that you probably need to be evaluated potentially for sleep apnea. Going along with those symptoms, episodes of not breathing, so gasping, waking up gasping for air in the middle of the night. Another telltale sign, non-restorative sleep. So this is when you get up and you're like, I might as well not have gone to bed at all. I feel like I didn't have that sleep at all. We can experience sleep attacks. And so this is rarer and it comes with narcolepsy. But this is when someone will be going about their day and then all of a sudden lose muscle tone and go into sleep. As you can imagine, that's not safe for driving or really many activities. Restless leg syndrome, if you're feeling like you can't stop moving your legs or you need to move your legs at night. If you're sleepwalking, that's probably a sign that you need to talk to your provider. Acting out dreams or having very vivid dreams. This one I'm sure is very scary for folks that experience it, which is sleep paralysis. This is waking up and not being able to move. And then, teeth clenching and or grinding teeth is also something that probably should get talked to with a physician, because you could really be hurting your TM joints, your temporal mandibular joints, as well as your dentition. So I don't know if this is surprising to you all, but I certainly find that this is a very underappreciated sleep disorder, which is obstructive sleep apnea. And so 4 to 9% of middle-aged men and 2 to 4% of women suffer from sleep apnea. So we're talking about 25 million Americans having sleep apnea. I also see it in young folks as well. And so really when we think about this, I could give a whole talk on obstructive sleep apnea, but this has really negative consequences, because with the apneic episodes, the not breathing, that's resulting in damage to the brain over time, because our brain loves oxygen. When we have these multiple episodes of oxygen deprivation overnight, it can really mess with our cognition, our mood, and our overall health. So this is something, when I see folks clinically, really getting it on people's radar and get the appropriate intervention for that. which is usually in the form of, as most of you are nurses on here, so CPAP machines, things that force oxygen down the airway. So let's talk about sleep hygiene. So when we're thinking about sleep, really it's very important to make sure that things like a healthy diet and exercise are really our routine. And I should have said this at the beginning of my talk. When I'm making these recommendations, I certainly know that these things are not easy to institute, and it takes practice to get these into our life if they're not already. So, but physical activity more days than not is really important. So we're looking at over 150 minutes of cardiovascular exercise a week, spaced out, of course, throughout the week, but very important for quieting the mind and helping with the sleep cycle. I certainly love caffeine myself and could not be here without it. I have a 3-month-old at home. I don't know if I'd be upright giving you the Zoom right now if I didn't have coffee in my blood. So I'm not saying don't use caffeine, but I will say to you that we need to limit it at a certain hour. And I think I have that number on the next slide. Really, this one's a hard one. Only use the bed for sleep and sex. So not using it as an office or a movie theater. Another one I think that is hard to institute is having set sleep and awake times regardless of the day of the week. So even on the weekends. And the awake time is also regardless of how much sleep you got the night before, which is hard. So really setting hard bookends for your sleep that you keep. Another one that is recommended is so this is where I said, it should only take us 15 to 20 minutes to fall asleep. So if at that 20-minute mark, you are still bug-eyed and wide awake, it's really thought that it's best for us to get out of the bed and go into another room and do something else such as listening to quiet music, meditate, or read a book, but not on our screens. So read a book that is actually physically a book because of the light. We don't want to be on our phones, our computers, or our TV at night before we're going to sleep. And I think it's important too to figure out, and this is very different for all, do we need to be able to unwind before bed? And so really, we're going to talk about sleep diaries in a minute, and we'll revisit this, but it's very important to figure out how much time do I need to start quieting down before I'm going to be an effective sleeper. Naps, everybody always asks me about napping. So obviously, if you're experiencing daytime sleepiness and you're not able to get through your day, napping not allowed. But if you do nap, really we're wanting these to be smaller naps so that you're not really fully engaging in a sleep cycle. So really we're talking about less than 45 minutes here. So yes, nap if you absolutely need to, but make sure that it is shorter in duration. We know that alcohol certainly affects the sleep cycle and the architecture of sleep. So really not having alcohol 4 hours before bedtime is good. Avoiding nicotine. Caffeine, we really should be avoiding 6 hours before we try to go to bed. We also think about our GI system. Sometimes that is what's keeping us awake. So thinking about avoiding spicy, heavy, sugary foods 4 hours before bedtime. And so if you're somebody that gets super hungry right before you go to sleep, something very light before bed is okay, but really it shouldn't be you're having dinner and then going to bed an hour later. That's really not good for our systems. Other things to think about are the room itself and your bedding. And I think sometimes we don't think about this, but recently I invested in the most amazing gel mattress top, and it was a game changer for me. So having a comfortable bed and bedding is extremely important, especially for those of us on the call that feel very arthritic when we get up in the morning. Temperature is also really important. Most of us, I know this is counterintuitive, but sleep better when the room is colder. So having the room a little chillier and well ventilated is very, very important. And trying to have as much light out of the room as possible is also really important. So if you can get room darkening shades, and also trying to black out noise as much as possible. And so maybe this is thinking about getting one of those sound machines that do either rain or white noise, sort of whatever works for you. But sort of some of the main sleep hygiene things that we talk about for helping with sleep. So when we're in this rut of not being able to sleep well, oftentimes if you go to a sleep clinic, they'll ask you to engage in sleep journaling. And so, you know, if you're someone on the call today that's having sleep problems, you can start doing some of this detective work yourself and start journaling some of this information that's really helpful. So, you know, how long does it take you to fall asleep when you first get into bed? How long and well do you sleep on a given night? How many times do you wake up? And how long does it then take you to go back to sleep? Monitor caffeine and alcohol, and also what you put in your body in terms of eating and drinking, and how much stress is going on that day, and what medicines do you take, and exercise. So this, if you are having sleep problems and you do end up going to a sleep specialist, this is the stuff that they're going to want to talk with you about, because this is going to help them to determine, is it a sleep initiation or maintenance issue? Or are there certain lifestyle factors that you can change very quickly to get a win with this and improve the sleep? So I think for all of us, it's really important to try to figure out in terms of our wellness, if we are having problems with management of stress and sleep and getting enough downtime. I always talk to folks about being an anthropologist for a couple of weeks about yourself and studying yourself. And what do I mean by that? So I say to folks, when we're having trouble regulating our mood, or we're just not feeling well, not sleeping well, get a bullet journal or a piece of paper, whatever, and really start to study to help figure out what's going on. And so I encourage you to start writing down at the end of the day, what did you do in that day? How much time did you spend on that? And then maybe jot down how you felt that day. And so really the point of this is to help us figure out a few things. What are triggers? Can you find a theme across these weeks that are triggers for when you do have a bad night's sleep? Maybe you find that it's engaging with a particular coworker and you need to figure out how to navigate your interactions better. Or maybe it's that you're exercising too late in the day and that's revving up your body. So maybe you need to be exercising in the morning before you go to work. That one's not easy. I transitioned my clock myself recently so that I'm up very early to sleep, husband and kids, to do my workout. That was a challenge, but it paid off in the end, quite frankly. But this journal will allow you then also to look at, gosh, what am I doing at night that may be counterproductive for my wellness in terms of sleep? So, you know, what time do I need to stop working, or, you know, doing things around the house that really is, really sets me up to start quieting my mind. Oftentimes when I talk to people that are having trouble with sleep initiation insomnia, they say to me, Lauren, it's that my mind is just way too active at night. And then we need to think about, okay, well, what do we need to push back in order to get your mind to start quieting down? And so with the med students, what I talk about is that oftentimes they're pushing their studying too late into the night, even when it's not a test day the next day. And so we talk about really trying to tell our bodies, okay, work time is done. Now I'm transitioning into unwind, and maybe trying to do a meditative practice just for a couple minutes, really, at that transition from end of work to beginning of rest time. It can be very helpful. So I would encourage you, if you're having any problems with mood, anxiety, stress, trying to fit wellness in or sleep, to do this journaling exercise, because I think that you'll learn a lot about yourself. I think that a lot of us, guilty as charged, mindfully go through mindlessly, go through our weeks. And then when we write it all down, we realize, oh my gosh, I am not eating as many meals as I thought I was. I'm not drinking enough water, or, I'm not getting breaks in here and I really need to figure this out. So it's a cheap therapist. It's the cost of a composition book and a pen, and it can be really helpful. These resources are really great. The sleepassociation.org and sleepadvisor.org. And I want to show you sleepadvisor.org. Oh, you know what? Oh, here it is. Okay, good. I thought when the Zoom crashed, everything in my computer kind of went wild. So this is a really great website. It talks about, and they've like kind of vetted things from mattresses, because sometimes the sleep issue really is just as simple as buying a new bed. I mean, sometimes we do unfortunately have to invest in a mattress that's great. Then we think about, there's other recommendations for sleep hygiene on here, the science of sleep, all kinds. This is a wonderful resource. And then, the Sleep Association is also there, but I really like this. I mean, and these all link out to articles for you, even from like how to feng shui your bedroom. How do you organize your bedroom in a way that makes it conducive to sleep and relaxation? So this is really cool. I would encourage you to take a peek at this and sometime, but because I really do like the website a great deal. So now what I'd like to do is I want to open it up for questions at this point, because I want us to end with a sleep meditation that I'll talk about, but I like us to sort of leave our time together kind of in a quiet and more relaxed state. So I'm going to open it up now for questions. I'm going to stop my screen share. I just love Bert and Ernie. Those guys are hysterical. All right, I'm going to stop my screen share, and then certainly you can ask a question verbally by unmuting yourself, or you can throw it in the chat box. And Elise, certainly you and I have been good co-hosts at the end. Fire questions at me, whatever you guys prefer.
I was curious if you had, and I didn't know if either of those two sites you showed had like actual, like I had someone recommend to me doing specifically like body scan meditation at night. And that helped me so much. So I didn't know if you had favorite resources. And I did the ones, they were like 12 minutes, 13 minutes. And it actually, like, it surprised me that it helped.
Yes, it totally does. Yeah, they have some on that Sleep Advisor one. And then the other app that I love is Headspace.
Okay, yeah.
Put it on your phone and it has all of that. But the body scan stuff is really fantastic. And, if you find a script that you really like, that you only maybe find online that's printed, some folks that I've worked with have recorded it and then listened to it on their phone, or I've had therapy patients ask me to read it and then they record it in session and then they listen to it. Or if you have a loved one that you love their voice, have them read it for you. I think also the role of quiet music is super important too. So kind of both of those things. The students that I work with love Headspace, and they all pass out to those meditations at night. They really like it. So any questions about any of the material, or just anything you guys wanted to talk about that wasn't covered related to sleep? I think that this is a hard area for all of us because we want that 25th hour in the day, and it goes is sleep, right? When we're trying to squeeze that extra time in the day, we sacrifice sleep, which is unfortunate.
And I tell you what, I used to do dementia education for the Alzheimer's Association. That was one of the things, we talked about, and you spoke to this, about how we have a culture in the US of like almost bragging about and like sleep and healthy exercise, I think, are like the first things people stop when they're stressed, parents, giving for adult, aging parents, like there's just so many things that can get in the way. But we also saw that sleep was directly connected to risk of developing Alzheimer's disease later in life. Like, I mean, it's just the health implications are so intense. Like, I protect my sleep now ever since learning that. Like,
yes, absolutely.
It's a non-negotiable for me.
And I'm going to be honest too. I think that we don't 100% fully understand what is going on with sleep, the importance of it. So, I mean, I think obviously we know some, But I mean, yes, absolutely. The protecting of sleep is extremely important. And you had mentioned your work with the Alzheimer's Association. I can't tell you how many times I see folks in my clinic that have sleep apnea that hasn't been diagnosed or even discussed. And I'm like, hello, this is crazy what I'm about to say. I'm like, that's exciting, because that means that might be a reversible cause for your dementia. And we need to get that intervened now to see if it's not a progressive neurodegenerative disorder.
Absolutely. I had a friend who I even just recommended you can order like online those like they're like retainer things that help keep your jaw from sliding back. And so like even if you suspect it's the issue, if you're concerned about cost of going to like a sleep specialist, like you can get those online, and they just help keep the throat open. And it like helped my friend get better, because she was a snorer, like a bad snorer. And I was like, you probably have sleep apnea.
Right. And I think there's also a myth out there that it only happens, you know, if we have a little more weight that we want to get rid of, or when we're older. And that's absolutely not the case. I have a lot of young folks that I see that have sleep apnea, and we're just like, I don't know where that's coming from, but there must be something with their airway that makes them more. So, okay. All right.
Any questions or anything? I didn't see any yet come through.
No, I don't think so. So because I know we had a hiccup with the Zoom and everything, I'm going to go ahead and, if it's okay with folks, I meditation with you guys before we get off the call. So this is called letting go of fixing. So I think a lot of times what's happening at night is that we're engaging in what ifs, and I should have, and all of these things. So I'm going to just kind of walk you through this. So letting go of fixing. So just sit comfortably. When there is discontentment, the natural habit is to correct it. The mind goes into fix-it mode, and this often results in circular thinking, trying in vain to solve a problem. Although reflection and goal setting are useful, the obsession that you experience is often not. So this exercise is going to work on this fixing it thinking. And you can always use this in formal meditation and return to this at any point during your day when you notice that your mind is stuck in a loop of problem solving. So sit up as straight as possible, inviting alertness into the mind and body. Take a few deep breaths, energizing the body. Begin to tune into your thoughts. What problem are you working to solve? Is there something specific you want to figure out or fix? Notice the issue itself, not your thoughts about it. Try to clearly see what the problem is, rather than focusing on the solution. With the problem in your mind, notice any discomfort you feel around it. There may be some fear of the unknown, insecurity, or a desire to plan something. Whatever your experience is, look at the issue with tender awareness. There's no need to judge yourself, beat yourself up, or jump right into fixing it. Just be with the discomfort. As you rest in awareness of the problem to be solved, begin tuning into the mind and body. Is there tension in the body? No. Recognize when the mind jumps into the desire to fix the discomfort by saying to yourself, fixing. With the intention of meeting your experience with patience, offer yourself a few phrases of mindful care. I see this discomfort. The mind wants it. May I be with this problem. To close this meditation, take a minute to ask yourself, what can be done? You don't need to come up with a clear step-by-step plan. All right. So, there's lots of scripts out there like that I would encourage you to, if you are having trouble falling asleep at night, to take a look at. And I certainly appreciate you guys sticking with us despite our little technical snafu today. Next month, I am going to be speaking about grief and how we cope with grief and the signs of grief. And I think that it's a lot more prevalent now because of COVID in a lot of folks' lives. And I really appreciate you guys sharing this time with me. I hope that you are well and safe, and I look forward to our time together next month. Oh, there we go. April 14th at 10 a.m. Okay. Well, you all take care. Thank you for having this space with me today.
Thank you, Dr. Lauren.
Okay. Bye-bye, guys.